So incredible job. And at this point, I would like to welcome Ms. Julie Goff and Dr. Kleefstra to join us for a live Q&A session.
Hello. Hello there.
Hello,
Can you hear me?
Hello, Julie. We can hear you.
Okay, great.
Hello, Julie. How are you?
I'm good.
Good. I've got to tell you, Julie, that was pretty impressive. You are awesome.
Thank you.
I was taking some notes here during the discussion, and here's a few quick comments people made. Julie is amazing, one parent said. Another parent said, I'm literally crying tears of joy right now. Another parent said, I'm speechless. And another said, you provide hope to the KS community. So bravo, outstanding job, Julie. And thank you so much for sharing your story today.
Thank you.
You're welcome. You're welcome. And Dr. Kleefstra, as always, thank you for being involved as much as you are, and you're so grateful with your time, and we all appreciate that very much.
Yes, of course. Thank you. Glad to contribute, and it's really amazing that you achieved this wonderful day again, and have so much of interest and shareness that is helpful to everybody. So great. You organized. Yeah.
Well, good. Well, thank you so much, Dr. K. So I have been logging some of the questions. We've had a number of good questions come in through the chat. And Julie, I think I'm going to start with you, if that's okay. The first question that came in, Julie, is how has it been living on your own away from your family since you went to college?
Well, I love it. And the good news is that then I already had prior experience living away from my parents before I even went to college. When I went to a boarding school, where I learned how to live independently. And I love how being away from at college gives me a lot of independence. Especially with like transportation, and like I have to do my own laundry and stuff.
Yeah, good for you. It sounds like you're doing a wonderful job. Another question that came in, what do you like to do with your friends at college?
Well, I like to go to some of the events that they have on campus. Like, for example, last night I went to an open mic night / karaoke night with a group of my friends. One other thing I like to do is I like to be in like clubs. Like I'm part of a club called Best Buddies. There's like a Best Buddies International, where like each specific school has their own chapter. And one thing that I like about Best Buddies is how we get to interact with people who have disabilities. And there are even some volunteers from my school who help out the buddies. And well, we're virtual this year, of course, because of COVID.
Yeah. Well, that sounds incredible. So I do have to ask if you like karaoke. Do you have a favorite song that you sing when you do karaoke?
No, I don't. But yeah, I performed a song that I sang as part of the summer musical that I did called Godspell.
Okay.
The song that I performed yesterday was Beautiful City.
Very cool. Good for you. So it sounds like you're very active and really enjoying college. Another question, what is your favorite part of being a college student?
Well, I like being around all my friends.
Yeah.
And I like taking all of the interesting classes that they have. And I just like having the independence.
Yeah, good for you. Good for you. Well, you're doing a wonderful job. Another question that just came in, Julie, says, do you follow a special food diet at all as you eat? Are you eating junk food, college students do, or do you follow a special diet?
Well, it all depends on what's good in the dining hall,
Yeah.
because the dining hall food is not the best.
Well, I have a college-age daughter as well, who's actually on the webinar today, and she tells us the same about where she goes to college. So I understand. Well, good. A couple other questions. So you talked about, and this one's a little bit more serious, Julie, but you talked about in the interview about tornado experience, and sometimes it takes a little time to calm down. Do you have any advice for parents or brothers or sisters on if someone with Kleefstra syndrome is experiencing that tornado type of event? How should we as family members work with that person to help them get through that event?
Well, don't criticize them for doing anything wrong, because they might be trying to tell you something that they might not be able to verbalize.
Mm-hmm.
So one thing that my parents do is that they ask me to go to my room and spend a few minutes in there to like calm myself down.
Mm-hmm. Do you have any advice for younger children with Kleefstra syndrome who are on the video conference today? I have my 8-year-old daughter, and I think she looks up to you as a role model. Say hi.
Hi. Hi.
And she's known about you speaking for the last week, so she's been asking if when she gets to see Julie. So it's an important day for her. But do you have any advice for younger children with Kleefstra syndrome?
Well, not for the children themselves, but for the parents of the children with KS, I would say it's important to like be patient with them and give them time to get their words out, because more than likely than not, they might know more things than they can actually verbalize.
Mm-hmm. That's great advice. Patience, absolutely, great advice. Another question, what's the best support that you received by teachers, therapists, or family that really helped you along the journey?
Can you repeat it?
So the question is, what was the best support that you received from either teachers or therapists or family members that have really helped you as you've grown up?
Well, the one thing that I would like to say is that my mother has been very nice to me in helping me arrange like all of the therapy sessions that I have been going to. And well, I think the best point that I get now is the academic coaching that I'm in, because fortunately I've known her since like my first year of college, and we formed a very good relationship.
Good. Well, that's very good. It sounds like you have plenty of love and support around you, which has been a big part in your life, which is incredible to hear. Another question Mindy Kramer just sent in: has Julie had ready to meet others with Kleefstra syndrome? Do you know other kids or adults with KS by chance?
Well, I know of a 12 or 13-year-old kid who, and we video chatted with her and her family during COVID.
Well, that's very good. Well, I've got to tell you, you're probably a bit of a celebrity now. So most KS kids and adults are going to know who you are, and I would imagine you will meet others over the coming years. So it's very exciting. So I am going to transition, Julie. Thank you so much. You are an inspiration. Stay on the screen with us, but I'm going to transition over to Dr. Kleefstra now for some questions that came in as well. So Dr. Kleefstra, the first one that came in, how does it feel talking directly to someone that has a syndrome that was discovered and named after you? How does it make you feel to work through that interaction?
Yeah, that's really amazing. And there's an echo over here. Is that a... No, I think it's gone. Yeah, so that's really incredible. But every time there is this novel diagnosis, also in our hospital or in the Netherlands, referring to our clinic, that we have this multidisciplinary care and we have different professionals, and we then once a month we discuss all the cases that we have seen, and the parents and the individuals like who are quite verbal. Every individual, is special, and it's really every time again special to have such a conversation with something that started, as I mentioned, in this beginning of the century, with very labor-intensive work in our team to find the cause of a syndrome that was not yet defined or had a name, and then finding the gene, and then the first individuals with the gene mutations, and now we are 15 years ahead, and it's really, it keeps being special. And we are still surprised with all individuals diagnosed. Our spectrum and our knowledge is still growing.
Yeah, absolutely. So to that point, what can we as parents do to help you? I know in the interview we talked about data a little bit and access to data, and we've discussed that at iDefine as well, and fundraising leads to research, et cetera. But how can parents and family members help you and other doctors and scientists push research forward?
Well, I think you indeed, as you mentioned, you did and still do, of course, an incredible job with getting all this foundation and getting the world on a global level together in a virtual manner. And things, take time, but indeed, personal and money, and in the end, it always is that the issue. So the more people working on it and the more budget there is, the more you can do. And that for rare diseases, and especially focusing on one rare disease, there is very difficult to get funding from grant agencies that you request. So for me, you are a wonderful support already for our research, and there's also with people in Europe, but there is of course different legalization and different issues that are different from USA, and so I'm also very, very grateful to the European parents that are really supportive in getting on a European level things organized, because we can't do everything indeed by ourselves. That we lack the team and the support of people that can do that in a professional system that we currently have. So just continue with that, I would say. I think the achievements that have been made in the past 2 years are really great. But keep in mind that we are only a very little team also in the Radboud UMC. So we have our daily work that is not dedicated to Kleefstra syndrome. We are just doing our clinical work and the teaching and all the stuff that needs to be done in the academic life. And the work dedicated to Kleefstra syndrome is not, there's not a budget on table that says, well, you can spend a day or 2 days. So we really need to live from dedication and from budgets, from grants that can support, especially also the younger and to get younger people involved, like Joost and Lara, who I brought into some meetings also. They are currently paid by grants for a few years, and they are really needed to translate knowledge and to gain knowledge also to the younger generations of doctors. So just I would say just keep as much as what you're doing and get everything connected, and then I think we can achieve great things in the coming years together.
Well, no, that's all very good perspective. Obviously, in the rare disease space, there are so over 7,000 rare disorders around the world.
Yes.
Most of which get very little attention from big pharma, biotech companies, and patient-led
Yes.
patient-led organizations like I Define are so critical to funding and driving that progress forward. So I can tell you, with the people on this webinar today, I feel like we have an incredibly committed group of people that seems to be proving itself out in fundraising and volunteer and advocacy. So we will continue to support you. And I know we have some really determined people on this phone or on this webinar today who are committed to doing so.
Yeah, and I think in addition to the work that we are doing, the clinical work, there is a wonderful, let's say, preclinical team also in the Radboud UMC who is really doing very exciting work on this cellular models and also on the animal models. So we have this mouse model of the syndrome and the Drosophila, the fruit fly model of the syndrome, but we also do have very inspiring and very fascinating cellular models. So where we can, in a dish, in fact, well, look at some level to neuronal tissue that we can derive currently in the lab. So that's really so when Julie asked about novel insights of recent findings, I think that's really incredible that what can be achieved currently in the laboratory. But then again, it doesn't go that fast as we would like, of course. Yeah. But there's also a lot of potential in obtaining insight in mechanisms and in how does it work in the brain, but also to the way to treatment. I think it's really great opportunities nowadays.
Yeah, no, that's very good. So another question that just came in, this fairly direct question, but I think it's relevant. It says, how much money would you need for an annual budget to focus 80 to 90% of your time on KS? How much money, as we're looking at fundraising in all of these different areas, obviously we're attempting to fund research and the Kleefstra Clinic and family support and involvement. How much money are we looking at? I know it's a lot, but do you have any estimates that you would be comfortable sharing with the group?
Yeah, that's difficult. If I would say just for a younger person, a younger doctor like Joost or Lara, who should be supervised but can perform their workday, their budget is around 300,000 euro for 4 years. Okay. For the younger researchers that can help to fully dedicate to do research, also clinical research on the syndrome. I think that's around 300k euro for a period of 4 years. That's sort of about the budget that we handle. Yeah.
Yep. Okay. Perfect. Thanks for answering that question. Any advice for parents on identifying the symptoms of regression? So this comes up typically on all of our Define calls, but for some newer families out there, what should we be looking for?
Yeah, I know. We are aware it's really a worrying issue, and like what I mentioned, currently we just don't know what percentage. So who will face such dramatic periods in the labs and who won't? We just don't know. But we know not everybody will go through such a period. So that's something to be to keep in mind. For the ones that unfortunately are going through such a period, well, I think the most important symptoms are that you see your child changes in communication, in social communication. That's, I think, the most important aspect. So the way you communicate with your child and to have, or the society communicates with your child in school or in other daily activities, that changes. So there's less contact possible, and they may have some weird behavior that you don't recognize from your child. And these are worrisome symptoms, but please, this is not that we see at younger childhood age. It's not if your child is 4 years and you think, oh, see or he does behave differently or change. That's not the regression that we the way we regard. So we regard it as a real loss of functioning in late puberty or young adulthood. That's more lasting for a longer period. But I think in the social content, in communication, I think that's the most important to have the alarm bell ringing in your head and not sleeping so well. So we all have periods that we not sleep so well. At least I do have some periods that I that my sleep is not so good. But the sleep defects that we're talking about are really severe. So then your child might not sleep at all for nights after each other. And that's of course for all, that's really devastating. But if such symptoms you face, that then you may think of maybe we are now facing such a period, and then the advice is, if there's not yet a psychiatrist involved, that's important to have somebody in your team, in the medical team, that can that doesn't per se need to have knowledge of the syndrome, because the advice on treatment we can provide also on a distance. And there's also some literature where we did write it down, and we also advised already several cases on a distance. There's also 2 cases that have been written down in a case report in medical literature that treated the patient they had in the clinic with Kleefstra syndrome based upon our advice with a favorable outcome. So it's not per se needed that the team involved has a lot of experience, but because you cannot request such, I think we in Nijmegen have now some experience at least, but that takes years to have that built up. But so I think that these are important symptoms, but please remind, it's not happening in all, and probably not in half of the population, but that's a bias that we have seen, of course, for the last 10 years. We get only referral of young adults when problems arise, and if there are no problems, we don't hear about it. And that's important for the longitudinal history because then that's a prospective study. You don't know up front who will be affected and who not.
Yeah. Very good, Dr. Kleefstra. So I'm getting the cue that I need to wrap. We have more programming to move forward with.
Yes.
This has been incredible. What I'll tell folks is some of the questions that came in, we didn't have an opportunity to get to around mutation versus deletion and more detail around regression. However, we did host a scientific conference back in February, and that entire conference is posted on our YouTube channel. So there's a lot of content out there as well. And if others have questions that they didn't feel like got answered, you can email us at unlock@idefine.org, and we can try to get to those questions as well. But just incredible dialogue here, Dr. Kleefstra. I really appreciate always your transparency, your commitment to our community. You're a true professional, and we very much appreciate it. And Julie, you are a rock star. Thank you so much for taking the time today and sharing your story with us. I think you are, as mentioned, a bit of a celebrity inside the community now, but an inspiration for so many. So keep up the great work, Julie. And we look forward to seeing your progress as you graduate college and move on as well.
Thank you. Thank you so much. Thank you.
Thank you both. We are going to hop